I got the one now, but I joke around. All right. So again, we're going to be looking at the nervous system, and with the nervous system, again, we look at the central nervous system. The central nervous system is made up of what parts? The central nervous system, brain and the spinal cord. All right. The peripheral nervous system is made up of what? The peripheral nervous system. What is it made up of? Your 12 pair of cranial nerves and your 31 pairs of spinal nerves. Okay? Now, what is the bones that protect the spinal cord? You had that in anatomy 1. The vertebrae, lumbar, thoracic, as well as, don't forget about now, the frontal lobe, the cranial, where the frontal bone, the skull. All right, it controls it. All right, so we're going to be looking at the conduction system. All right, conduction means to what? Transmit a signal from one point to another. All right, so when we look at it, when information comes into the central nervous system, that consists of what? The brain and the spinal cord. It travels along what we call tracks. Think about a train. A train travels on what? Tracks, okay? And they go either north, south, east, or what? West. And then if a train is going to change its direction, don't they have levers to direct the train to go either bear to the right or bear to the left? Right or wrong? All right, so when information goes up the spinal cord, it travels on what they call ascending tracks. And that carries what we say is sensory information. Okay? When the information comes down the spinal cord, it travels on what we say are what? Descending. And they carry what type of response? Motor. So the ones going up is what? Sensory. The ones coming down is motor. All right? And motor means it carries out a what? Response. Okay? Now, when you hear the word neural integration, that means when the information comes into the spinal cord or the central nervous system, it has to be what? Processed. And let's say when you call Lawson State and you don't know my extension, you may call the what? Switchboard, right? And when the operator answers, she may say, well, who do you want? You're going to say what? Dr. Pruitt. She's going to connect you to what? My office. So the integration system, once it gets that impulse, it processes it and sends it to the appropriate region in the brain to send it back out to the appropriate what? Muscle cell to carry out, or the gland. Okay? So let's say if my bladder gets full and I need to empty my bladder, well, I want that response to come in, but I want it to go to my bladder, so I will empty what? My bladder and not my what? Bowels. Make sense? So it processes the signal and sends it to the appropriate region of the body where you're going to get that what? Response. All right? Locomotion. What does locomotion mean? Walking. Movement, right? Coordinated movement. So you got to have balance and posture. What is a reflex? All right. A voluntary or a involuntary type of what? Response. Okay? Now, skeletal muscles are what we call what? Voluntary. You can kind of control the degree of that reflex. But when you hear involuntary, do you have control over it? All right. So respiration, you have no control over. Heart rate, you have no what? Control over. Right or wrong? All right. So it's based on the stimulation of that particular visceral structure on how you what? Respond. So you know when you get nervous or anxious, your heart rate goes up? Or when you're relaxed and calm and the heart rate what? Goes down? All of that is based on what? Some degree of what? Stimulation. Make sense? So the stronger the stimulus, the stronger the what? Response. All right. So question. We all together? All right. All right. So the spinal cord. Again, nervous tissue that arises from the brain stem. All right. Who remembers the foramen magnum? Where is that located? In the base, in the occipital bone, right? And it connects the brain to the what? Spinal cord, all right? It makes up the upper 2/3 of our vertebral canal. It ends at lumbar L1. Then you got what are called the horsetails that can end like past the what? Sacrum, all right? So again, remember we said the peripheral nervous system is made up of what? Your 12 pair of cranial nerves and your 31 pairs of spinal nerves. All right? And we said the central nervous system is made up of the what? Brain and spinal cord. Okay? Makes sense, yes or no? All right? So are we good? All right? Question. All right. All right, so when we look at the anatomy of the spinal cord, all right, they say you got a longitudinal groove. All right. Where's anterior and posterior? Anterior is where? In the front. Posterior is where? All right, where's ventral? And where's dorsal? Dorsal in the back. Where's ventral? All right, so anterior and ventral means the what? All right, and posterior and dorsal means the what? Thank you. All right, so the spinal cord has a cervical region, a thoracic, a lumbar, and a what? Sacral. How many cervical vertebrae do you have? 7 or 8. All right, how many thoracic? 12. How many lumbar? How many sacral? Wait a minute, no. It's one, but it's how many parts? 5. And coccygeal? 3 to 4. But they are fused. I agree with you, so it's not a trick question. All right, but it's like maybe 5. But when it fuses, it's one what? Structure. All right. Then the cauda equina and the medullary, cauda medullaris, these are the tapered end, what they call the horsetail. All right. So they go down all the way from L2 to what? S5. So S5 means sacral what? Number 5. So that means sacral has 5 grooves in it to give you what? 5 sacral bones. All right. Now you got 2 enlarged areas in the spinal cord. You got a cervical enlargement and a what? Lumbar. This gets the lower region. This gets the what? Upper region. Okay? And they make up the areas of our what? 31 pairs of spinal nerves. All right? Makes sense? Yes or no? Any questions? You don't have to worry about trying to write every word because they're on Blackboard. Okay. All right. So once you click on Blackboard, I got 2 chapter 12s. I got one that says audio. You can listen, and the PowerPoint's going to come up. Then toward the bottom, it's going to have chapter 12, just PPT. Those are just the PowerPoints without audio. Okay? So you don't have to worry about trying to write everything down. All right? And it's good to print them before you come to class. And when you print them in handout format. Because if you print them single pages, you know, like this one may have 64 slides. Some of them can have up to 200. All right, so print them PowerPoint. All right, handout style. All right, so this is the dorsal or posterior aspect of your body. So this would be the occipital. You got C1 down to what? C7 or C8. All right, so C7. Then you got T1 down to what? T12. All right, this, they say a cervical enlargement and a what? Lumbar enlargement of the what? Spinal cord. All right. Then if you look at it, you can see the cauda equina and you can see the horsetails that's associated with that. All right, hold on 1 second. All right, so if you look at the spinal cord, now if you remember from 201, the vertebrae, all right, who remembers where do you find the intervertebral foramen? The intervertebral foramen. Where are they located? Who remembers? Intervertebral foramen. Anybody remembers? All right. They're coming out of the side of what we call the intervertebral foramen. All right. You see? Foramen is a what? All right. So here's the vertebrae coming out. All right. That's like your spinal cord. It goes down the center of all your vertebrae, right? Here's your sacrum and your coccyx. So remember L1, then you got the cauda equina and the what? Horsetails that hang on what? Down here. So when I say the intervertebral foramen, this is where the nerves exit out of the spinal cord. And they're going to either go what? Anterior or posterior. Okay? Makes sense, yes or no? Okay. All right, so meninges. Meninges are what we call fibrous covering that protects the brain and the spinal cord. All right, so you got what are called the dura mater, the arachnoid, and the pia mater. All right, so they surround it. How many people heard the term spinal meningitis? Anybody? All right, tell me, what is spinal meningitis? Okay. When you hear the word itis, what does that mean? Inflammation. All right. So spinal meningitis is inflammation and infection of the what? Spinal cord or spinal fluid. How do you diagnose spinal meningitis? A sample. How do you take the sample? Spinal tap. All right. Why is it important to identify the type of infection for spinal meningitis? Remember, it could be either bacterial infection or a what? Viral. Let's say it's viral and you treat it with an antibiotic for bacteria. You can kill your patient. Or if it's, you diagnose it as being what? Bacteria, but it's really what? Viral, and you don't treat it right. Wrong what? Treatment regimen. All right? All right, so when we look at them, the dural sheath, it surrounds the spinal cord, and it separates the vertebrae by the epidural space. All right? Have you ever heard of an epidural block? All right. And what they normally do is they lay the patient down, they bend them over, they find that lumbar, but they make you bend over to form a what? Space. Then what they do is they inject a needle attached to a syringe with the anesthesia. All right? But before they inject, what they would do is they would separate the syringe from the needle, and they may let 1 or 2 little drops come out, then they'll reconnect it, then they'll aspirate. Why do you aspirate a joint or a region? Anybody know what aspirate means? That is, if you got a needle with fluid in it, when you put it in a joint, you draw back on the syringe to make sure you're not in a blood vessel. All right, and if no blood comes into the syringe, then you can inject. If blood pulls into the syringe, you need to pull back, aspirate again to make sure there's no blood in the syringe, then you can inject, because you don't want to inject it into a what? Blood vessel. All right? So when I asked you, anybody knew what aspirate means? No one asked me or said nothing. Don't let me say something and you don't know what it is. All right? Ain't no shame for not knowing, right or wrong. Okay? And how can you help yourself unless you know what something what means? So as you read, and if you come across something that you don't know the definition of it, what should you do? Ask or look it up. If I'm not here, look it up. All right? Because understanding the meaning helps you understand the what? Material. All right? All right, so the arachnoid, it adheres to the dura, and it's separated by the what? Pia. All right, so it separates what they call the subarachnoid space. And it's filled with a fluid called what? Cerebrospinal fluid. And the cerebrospinal fluid is a fluid that encompasses the brain and the spinal cord. All right? So what do you think the fluid does? What's the role of the cerebrospinal fluid? Cushion, buoyancy, again, protection. It's a good environment to provide what? Nutrients. And it also removes what? Waste. Look at it like when you're pregnant and the baby's surrounded by what type of fluid? Amniotic fluid. And it cushions the baby, it protects the baby, it provides what? Nutrients. Same thing the cerebrospinal fluid do. All right? So this is where you do your what? Spinal taps or lumbar puncture. All right? And the pia is a delicate membrane. It forms the contour of the what? Spinal cord. All right? And it goes all the way down to where? The coccygeal ligament. So it comes all the way down here. So it up here, all the way down. And it circulates what? Back up again, so it protects the brain and the spinal cord. All right? Make sense, yes or no? All right. Question. All right. So this is a diagram of spinal cord or a vertebrae. All right? How many people remember the parts of a vertebrae? You remember the body, right? You remember the what? Spinal processes. All right. If it's a bifid, what cervical vertebrae is that? C1 or C2? Who remembers when you look at the vertebrae in anatomy? All right. You remember? Huh? All right. So it's normally the second one. All right. Here's your what? Foramens. All right. But the spinal cord goes down the center, right? Just like that metal rod is going down the what? Center. All right. This is your spinal cord. Remember, in the central nervous system of the spinal cord, the white matter surrounds the gray matter. Okay? Now, when you do a cross-section of the brain, it's just the opposite. The gray matter will surround the what? White matter. All right? Question. All right. So when you learn the spinal cord, you got what is called the lateral horns, the anterior horn, and this is your what? Posterior. All right? And that little swollen thing right there is going to be called the dorsal root or the posterior root what? Ganglion. All right? I want you to remember that. All right, question. All right. How many people heard of spina bifida? That's when the spinal cord develops on the outside of a baby. And normally it's due to the fact that the mother has a small amount of folic acid during fetal development. All right, so it normally occurs early during development, somewhere around the 4th week. All right, so what you want them to do is to begin what? Supplement of folic acid, which is a what? Vitamin B supplement. All right, and that helps to cut down the risk of a baby having this what? When they say congenital, that means it develops where? In utero. Okay? All right, so again, when we look at the spinal cord and the anatomy of it, remember your posterior horn, your lateral horn, anterior horn. All right? The gray commissary, that connects both what? Sides. Okay? This is your anterior median fissure. All right? And that's your posterior median sulcus. So, on lab exams, and if I put a cross section of the spinal cord out there, all right, and I say identify that structure right there, all right, you would tell me anterior median what? Fissure. Or posterior median what? Sulcus. They both are called median. Why? Why are they called median? They're in the middle, all right? And remember your horns. If it's in the front, it's anterior. If it's on the side, it's lateral. If it's in the back, it's what? Posterior. Remember we said the meninges is a fibrous connective tissue what? Covering. It protects it, right? All right. Here it is, your pia mater, your arachnoid, and your what? Dura. All right. So they encompass and protects it. All right. So the gray matter, you got cell bodies. Have you heard the term myelinated and unmyelinated? Myelinated means is what? Insulated. Unmyelinated means is what? Not. So which one you think will conduct impulses more efficiently? A myelinated or a unmyelinated nerve? Myelinated. Think about your house. A house with good insulation compared to one that has poor insulation, which one is more energy efficient? One that's myelinated. Make sense? All right. Also remember that a larger nerve transmits impulses faster than a what? Smaller one. Make sense? All right. All right, so white matter is mainly what? Myelinated. Gray matter, that means they're dull. All right, that means they're normally what? Unmyelinated or have little what? Insulation around them. Okay? Question. Make sense, yes or no? All right. Now remember the spinal cord is that gray stuff inside. What does it look like to you? Does it kind of resemble a butterfly? Yes or no? Yeah, I mean, look at it. A butterfly with the wings. Okay? All right, so again, the posterior or what? Dorsal horn is in the back. You got anterior is in the front. Posterior is in the what? Back. The bar that goes across is called what? The gray commissary. It is a what? Bridge that connects the right side and the left side. Why is that important? Why is that important? Anybody? Yeah. Yeah, what else? That's a good point. What else? Think about you. Bodily functions. Think about impulses. Yes. Think about people who have strokes. Normally, if the stroke is on the right side, what side is affected? So you got to have that what? Connection. Don't you want what they say? Don't let your right hand know what your left hand doing. All right, make sense? All right. So that's why you got that connection. All right, the lateral horn, it is visible from thoracic vertebrae number 2 all the way down. All right. When they talk about the word autonomic nervous system, the autonomic nervous system has two divisions, sympathetic and parasympathetic. The best way to learn the two, sympathetic is for fight and flight. Either I'm going to fight or I'm going to run. One of the two. All right. Parasympathetic means to do what? Relax and be calm. Make sense? Sympathetic, exertion, activity, physical. All right? Parasympathetic slows you down. Sympathetic, increase heart rate. Parasympathetic slows heart rate down. Make sense? Yes or no? Okay. All right. You see the red going up? Ascending tract. You see the green going down? It's called what? Descending tracts. All right. Also, what I want you to look at, if you look on here, you see the word lateral corticospinal, lateral reticulospinal, tectospinal. The names tell you the type of tract, but also it's going to tell you what type of what? Sensation travels on that tract. All right. How many people travel? All right. You know, we used to do AAA maps, but now you do Google Maps, right? All right. When you do a Google map, they'll talk to you. How do they direct you? By what? Road signs, right or wrong? All right. Take Highway 65 for X number of miles. All right. But the name of the highway tells you where to go. So the name of these tracks tell you what type of impulse. Is it pain? Is it tickle? Is it itch? Is it hot? Is it cold? Is it smell? So based on the stimulus, it has to travel on a particular what? Track. And the name of it tells you whereabout in the spinal cord it is. Cortical means the brain. Spinal means the spinal cord. So it's on the lateral side of the corticospinal tract. It tells you where it originates and where it's going to what? End. Make sense? All right. Question. All right. So again, we look at the white matter surrounds the gray matter. All right. They mentioned the term axon. In anatomy last semester, what are the three parts of a nerve cell? The three parts of a nerve cell. Remember, axon, dendrites, soma. And soma means what? Cell body. Remember? How many people remember the term trigger zone or axon helix? What is the axon helix or the trigger zone? That's the region on the nerve cell that determines if the stimulus is strong enough to travel where? Down the axon. And what are the name of the structures at the end of the axon? At the end of the axon. Huh? No, dendrites are at the head. They bring the impulse in. What's the name of the ones at the end? Okay, junction, but what's the name of the structures? Axon what? Terminals? All right. Or what? Synaptic knobs or synaptic end buds. Why y'all laughing? What you scared of? I ain't gonna beat you. I left my rule in my office. I ain't gonna pop your little knuckles. Come on now. All right. So again, this is how they what? Communicate. So you got columns or what they call what? Funiculi. All right. They can be what? Lateral, posterior, or what? Anterior. How they divide it up. Tracts or fasciculi. You got the gracilis and the what? Cunate fasciculus. And you also have the gracilis nucleate and the cunate nucleate. And all this tells you is, does it start at what? T1 to T6, or does it start T6 to what? T12. Whether or not it deals with the upper extremity or the lower extremity. Okay? Good. All right. All right. So we said ascending tracks carry what type of information? Sensory. All right. Descending carries what type? All right. Now, who remembers these names? Sensory afferent, motor efferent, and what does effector mean? Effector. Effector. Don't look it up. Let me ask you something. If sensory brings something in and motor gives you a response, what does effector mean? Huh? Well, motor's bringing it out. Where's the motor going? Say it. Let's look at it like this. I inadvertently put my hand on a hot stove. Okay, so the effector is to seal that response. So if I put my right hand on a hot object, a sensory impulse goes where? Into my central nervous system. All right. It forms a synapse. All right. It goes in by the dorsal root of posterior ganglion. All right. It forms a synapse with the what? Posterior horn of the spinal cord. So it comes in from here. It's coming from here from my hot hand. It goes from here into here where it forms a what? Synapse. In the spinal cord, it goes up by way of my what? Ascending tract. It's going to go to my higher brain centers and tell my brain, look, Carl got his right hand on a hot stove. So therefore, he needs to contract his biceps or his biceps brachii muscle. So a motor response comes down out of my anterior horn, and it's going to go to my biceps and my biceps brachii for me to contract and pick my right hand off of that what? Hot stove. So effector is the target cell that carries out the action from the original stimulus. So sensory afferent breathes it in, motor efferent takes it out to what we call the what? Effector or target cell that performs the action. All right? Makes sense? Yeah, Walter. Is movement. Yeah. All right? Give you another example. How many you have cut up an onion? What happens? Why? You just say it? Because your husband got your butt in there cutting up onions to fix his meatloaf or something? Why do you cry? It burns your eye. So there's some type of chemical from the onion that's irritating your what? Eyes. So what do your eyes do? So that means there's a signal that comes in. It tells your brain, send a signal to my tear ducts to make my eyes cry. So this, now it's a sensory response, and the motor is going to a gland. The gland is your tear ducts. That's the effector cell. You tear up, and crying washes that onion chemical out of your eyes. Sensory afferent, motor efferent, effectors are your what? Lacrimal apparatus, which is your what? Tear ducts. Question. Real simple, isn't it? Lost anybody? Huh? You sure? You wouldn't lie to me, would you? Now y'all heard her. She said she's going to tell me. She ain't going to lie to me. All right. All right. All right. Decussation means to cross over. All that's saying is if the impulse comes in on the right side, your response is on the what? Left side. All right. Ipsilateral means if it comes in on the right side, it stays on the what? Contralateral, when the origin and destination of a track are what? Opposite sides. Same thing with what? Decusation. They cross over. All right? Ipsilateral, same side. Contralateral, decusation, opposite side. But here they just cross over at the what? Midline. That's all. All right. Neurons, first, second, and third order neurons. How many people watch, well, okay, let's do it like this. How many people travel? How many people fly? Anybody? All right. How many people have had to, you don't have a direct flight. You got a flight that may have 2 or 3 stops. What does that mean you have to do? Change what? All right. How many people watch relay? Anybody watch track and field? Where they pass a baton, like 4-man or 4-woman relay. So the first person starts off, right? They get to the second person, they pass what? They go to the third person, they do what? Then the fourth person carries it across the finish line. So the impulse comes in, it's a relay. First order neuron, then they pass it to the second order neuron, then they pass it to the third order neuron, then it terminates somewhere, then it comes down. So going up, it goes first, second, third, coming down, first, second, third. So neurons is just the tracks that's carrying that information, and they pass from one. So once it comes in, it can't go all the way. So they have to pass the baton to another set of neurons to carry it on to where it has to go. Question. Make sense? Yes or no? So first, second, third, and sometimes there's going to be a what? Fourth order neuron. Okay? I'm glad you asked. It's coming up. All right. All right. Remember I said gracilis, fasciculus, cunate, spinothalamic. That means that it starts in the spinal cord, it ends in the thalamus. This one starts in the spinal cord, it's going to end up in the reticular formation of the brain. All right? So what I'm saying is that body movement, limb position, fine touch, discrimination, and pressure. The impulse comes in, right? It forms a synapse here. That's the dorsal root ganglion, right? When it comes into the spinal cord, that's your first order neuron. So this anything with what? Body movement, pressure. If I push on you, that's pressure, right? Limb position. If I take my arm, I raise it up, limb position. All right, it forms a synapse. It travels now. It came in on this side. It's still on this same side, right? It's traveling up from the spinal cord. It's going up to the what? Medulla. At the medulla, it forms a what? Synapse. When it forms that synapse, it did what? It decussated. That means it did what? So it's on what we call the medial lemniscus what? Tract. Now it's on the what neuron? The second order neuron, right? Now it's on the opposite side. I go up through the midbrain into the what? Cerebrum. Here I form a synapse where? At the thalamus. That's my third order neuron. It goes up to the what? Higher brain centers, right? All right, my first order neuron, my second order neuron. So anytime I form a synapse, I transfer that signal into another pathway. All right. Test question. 90% of all sensory information that goes up to the higher brain centers must pass through the thalamus. Okay? Yeah, 90% of all the sensory information that goes up to the higher brain centers must pass through the thalamus. Okay. All right. All right. Now the diagram I just put up there, explain it to me. I took it away from up there. Explain it to me. Come on. Mm-hmm. Well, wait a minute now. We got to get it there. Where's it coming from? Come on now. Y'all, come on. Coming from where? It comes from receptors. Where are the receptors located at? They located where? On your body. Outside, right? All right. And they respond inside, right? So they have to start somewhere in your what? External environment. Then they got to go from your external environment into where? Spinal cord. How does it get into the spinal cord? On what type of fibers? What did we say? What are the name of the fibers that bring information into the spinal cord? What are they called? Don't look. Don't look. Come on. Think. What did I say? Yeah. Afferent. Okay, but what goes in front of the afferent? Sensory. All right, sensory. That means you're sensing something. How does it get into the spinal cord? What is the connection from the periphery to the spinal cord? What's the name of that thing that I say? It's a swollen region. The posterior or dorsal root ganglion. And it forms a synapse where? Where? Come on. Yeah, where about? You said gray, but where about? What horn of the spinal cord? Thank you. All right. So once it gets there, what neuron is it on? First order neuron. Then where does it go? Through the medulla to where? Midbrain. What happens in the midbrain? And that's called what? And it travels on what track? It's still on the ascending, but what is the track when it decussates? Medial lemniscus. That's the second order neuron. Then it goes up to where? Third order. And what? It has to go through the thalamus. And from there it goes, well, in the third order neuron up to where? Please do. Do it again. Is it hard?
No, we just need to do it a little more time so I can get it.
Say it. Go ahead.
I don't want to say it as a group.
Say it as a group. Say it as a group. Say it as a group. How do we do it? Think about it. It's what you do every day. Go.
Okay. So it comes from a sensor, from an outside source.
Yeah.
Okay. And we find out from our senses.
Yes.
Okay. And then from the senses, the senses will tell us what we need to do.
Yeah.
And if that is how. Okay.
Keep going.
Okay. So the senses tell us what we need to do, but what is it? I don't know that word.
Posterior ganglion.
Okay. Posterior ganglion.
And it carries the information where?
Spinal cord.
And it's synapsed with what? Don't look in the book. Close your notes. Close it. Close it. Close it. All right? Look. All right. Let's look at it like this. When you get up in the morning, and did everybody check the weather report today? All right, and you found out it's going to be 16 degrees, all right, before you went outside, all right. Before you went out there, you prepare yourself to dress what? Warm. Okay. All right, so you got to understand now, what goes on in the outside has to be relayed to what for the inside to know. So that's why we have receptors on our skin and stuff to tell the inside what's going on the outside, so we can, all right. So the only way that can get in, I got to call in to tell you what to tell something else, what to tell something else. So if it's hot in this room, you're going to start taking something off, or if it's cold, you're going to start. All right, but that means your body has to what? Move. So didn't we just say here that when we look at the spinal thalamic tract and things like this, we're looking at what? Body movement. All right, so you got to move. If I'm going to put a coat on and I got to move my limb to slide my arms in. All right, so that information is coming in from my skin. All right, it gets into my central nervous system by forming a connection by where the dorsal root ganglion, it always goes in the posterior horn of the spinal cord. That's when I form my synapse with my first neuron in the spinal cord. All right, then it travels to where I get to my second order neuron for it to cross over, if it's going to cross over. Then it's on what we call the medial lemniscus pathway. But I got to get to my upper brain centers in order to tell my motor what to what? Do. So this is bringing the sensory in. I got to go to my motor tract in order for me to carry out that particular what? Function. Very simple. Okay? Don't make it harder than what it actually is. All right? Question. All right. All right, so again, when we look at the gracilis fasciculus, it carries signal from the mid-thoracic and lower parts of the body, all right, below T6, all right. It composes the entire posterior column. At T6 and above is called the what? Cunate. So anything below T6, it travels on what? The gracilis fasciculi. Anything above T6 is carried on the what? Cunate fasciculus. That's all you need to know. All right? They carry first order nerve fibers traveling up the what? Ipsilateral on the same side. They terminate at the gracilis nucleus. Where? In the medulla oblongata. They carry what? Vibration, visceral pain. What is visceral pain? When you hear the word visceral, what does visceral mean? Your organs. All right? Can you feel your organs hurting? No. So what do you have? Huh? Yeah, when they said people having a heart attack, what side do they say hurt? Yeah, you get pain in the left side, left arm, radiating down the left side of the neck. If you got kidney infection, your lower back hurt. So that's what? Referred pain. Because you can't feel that organ, but it connects to some part on your body to let you know that organ is hurting. All right, deep discriminative touch. That means you can distinguish between what? Two different points of touch. Who remembers what proprioception is from last semester? Proprioception. Proprioception. Body position in space. What does that mean? If I say, close your eyes, raise your right arm. All right, do you need to look over there and see your right arm up? Can't you tell it's up? All right, so you got some type of receptors that's connected to that tendon to your joint to let your brain know where your body part is at all times. Proprioception, body position in space. Okay? So it's non-visual. That means you don't see the position of your body what? Movement. Make sense? All right. So again, T6 and above, cunate fasciculus. It makes up the lateral part of the posterior column. All right. They end in the cunate nucleus, and it's ipsilateral. All right. And then they say your second order neuron, remember we said it crosses over where? In the midbrain, and it travels on the what? Medial lemniscus what? Pathway, and it goes up to where? The thalamus, where you form your synapse with the what? Third order neuron up to the somatosensory what? Cortex. All right, spinal thalamic tract. It's located anterior and lateral. All right. What does it carry? Pain, pressure, temperature, light touch, tickle, and... All right, so when you hear the word spinal thalamic, it's telling you what type of sensations carried on that tract. So put a pin there. All right. All right, where's the first order neuron? The posterior horn of the spinal cord, right? Where's the second order? It starts where? At the posterior horn, then it decussates and form the what? Spinal thalamic. So that means it crosses over where? In the spinal cord. Then it travels where? Up to the somatosensory cortex, where it forms a synapse where? In the thalamus. Now let's see if they show that. Let's see if they show a picture of that. All right. So all thing you need to remember is spinal thalamic. It carries pain, pressure, temperature, light touch, tickle, itch. Okay. It forms the first order neuron where? In the posterior horn. Then while it's still there, it forms a what? Synapse. It decussates in the spinal cord to the what? Opposite side. Then it goes all the way up through the what? Medulla, through the midbrain, on up to the what? Thalamus. Then it forms a third order connection, and it goes up to the somatosensory what? Cortex. Okay? All right, the spinal reticular tract. It's also anterior and lateral. It carries pain signals for what type? So that means you traumatized. I stumped my hand, or I slammed it in a door. I cut myself. So it carries what? Tissue injury. The other one carries what? Pain. But this one means I have traumatized my what? Tissue. Where's the first order neuron? Okay. It immediately forms a synapse with what? So we're still in the spinal cord, right? It decussates and it goes up to where? The reticular formation, all right? It can be in the what? Medulla and or the what? Pons, all right? Then from there it goes where? To the thalamus, which is your what? Third neuron, right? Then the last one carries it up to the what? Cerebral cortex. So the spinal reticular tract, instead of 3 order neurons, it has how many? All right. Okay. All right, the spinal cerebellar tract. So where does it originate at? No, spinal, it originates where? Once the impulse comes in the spine, where does it terminate at? Cerebellum. All right? So what type of signals does it carry? Proprioception. And what did we say proprioception is? Okay. All right, so the first order neuron originates where? Muscle or, all right, then it ends up where? Okay, they're all going there, 90%, okay? Where's the second order goes to? It's still in the spinal cord, but it's going to ascend up in the spinal where? And where does it terminate at? In cerebellum. So what is it telling you? It's ipsilateral. So ipsilateral means what? Same side. Okay. All right, let's take 5, then we're going to do our descending tracts. All right? Question. The descending tracts, remember ascending carries sensory information in, right? Descending carries a motor response down. All right? So again, you got what they call upper and lower motor neurons. All right? So these originate high up, the cerebral cortex or the brain stem, and then the lower ones, they end up either in the cell body in the brain stem or the spinal cord. All right? So normally the target structure is going to be a what? Muscle. All right? Or an organ that is going to what? Innervate to tell it what? What to do. Now remember a minute ago we were starting at the spinal cord working our way what? Up. Now we're going to start up working our way what? Back down. Alright. Alright. So the cortical spinal tract is going to carry information from where? The cerebral cortex. And when we look at the cerebral cortex, where are we talking about? Up here. Right? So that's the higher what? Brain centers. Okay? So it's going down, so it deals with what? Precise, finely coordinated movement. Just like giving an injection, writing with your pen, doing dissections, precise, coordinated what? Movement. Cortical spinal tract. Alright? So again, you got pyramids on the medulla. Alright? And then it's going to travel down. It decussates where? Lower medulla, forming the lateral cortical spinal tract. All right. So when they say contralateral, that means it did what? It crossed over. All right. Some of your fibers are what? Anterior. We just said lateral, and some are what? Anterior. Right. We said the lateral ones, they did what? Crossed over. Anterior stays where? On the same side. All right. So the lateral ones control what? Contralateral movement, whereas the anterior cortical spinal tract concerns what? Same side what? Movement. So the only thing you need to know, cortical spinal tract, fine precise movement. Lateral ones on the opposite side, anterior on the same side. That's it. Okay? Question. All right, tectospinal, lateral and medial reticulospinal, and lateral and medial vestibulospinal. All right, tectospinal, it begins where? In the midbrain. All right, so it crosses over to the what? Opposite side. So what that means is if you hear a gunshot, you turn your head toward the sound, right? So tectospinal deals with what? Turning your head toward the direction of the what? Sound. That's it. That's a motor response. If I heard it, I'm turning my head. That's it. All right. Lateral and or medial. All right. So they originate in the reticular formation of the brain stem. It regulates your muscles of where? The upper and lower. So posture and balance. So for you to sit in that chair to keep from falling over, or you know, sometime when church go a long time, or when Dr. Pruitt talks so long, you get sleep in that chair, you about ready to fall out, where it catches you, help you maintain your what? Balance and posture. All right. All right. It also carries what? Analgesic pathways. When you hear the word analgesic, it helps to control what? Pain. Like narcotics are what you call analgesics. They help to stop what? Pain. So they carry what? Posture, balance, and some of them for what? Pain control. All right. Lateral and medial vestibulospinal. Again, vestibulo, that's where it starts. It ends in the spinal cord. It controls your what? Inner ear balance. All right. So it helps you control what? Your balance. Make sense? Okay. All right. So let's look at the anatomy of the spinal cord. Okay. All right. Again, you remember from your cranial nerves, they can be sensory, they can be mixed, or they can be what? Motor. Purely sensory, purely motor, or they can have both sensory and motor functions, right? You see the word afferent and efferent? Afferent carries what type? Sensory. Efferent carries what type? Motor. All right. Mixed means it carries what? Both. Okay. All right. All right. When you hear the word Schwann cells, these are what we call myelinated cells. They insulate the what? Axon. All right. You got three types: endoneural, perineural, and epineural. All right. Endo is around the external to the neural lemur. The perineuron, it surrounds a bundle, and epi, it surrounds the entire nerve. All right, let's go back. All right, you see the diagram? All right, epineuron, it surrounds that whole what? Nerve, right? Perineuron, it surrounds a what? Muscle fiber. One of them come out. And epi, it innervates and surrounds just one of the individual fibers. All right? So what I'm saying is, epineural, this is a big, thick what? Nerve. Epineural surrounds the whole thing. Bless you. These are what? Fibers or tracts inside. So it surrounds a what? Individual fiber group. And endo, it surrounds a individual what? Single nerve. Okay? Epi, the whole thing. Para, a individual group of them. And endo, a individual fiber by itself. Okay. All right. How many people heard the term poliomyelitis? Anybody? Polio is a virus that affects the nervous system. It destroys your motor neurons in the brain stem. And why do they say the anterior horn of the spinal cord? Because it deals with what? Skeletal muscle contraction. So if you damage those motor nerves, are you going to be able to walk and move good? So it can cause what? Muscle weakness, loss of reflexes, and even what? Paralysis. Okay? You can get it through a virus by drinking what? Fecal contaminated what? Water. Right? So it causes muscle what? Atrophy. What is muscle atrophy? Atrophy is the shrinking, a loss of muscle what? Function. Have you noticed people who are paralyzed, how their muscles get smaller and smaller? Where it's not innervated and they are not moving it. So have you heard the term, if you don't use it, you lose it? That's what atrophy means, shrinking up of the what? Muscles. Question. All right. All right. Amyotrophic lateral sclerosis, Lou Gehrig's disease. All right. It also deals with what? Muscle atrophy, right? How many people heard the term arteriosclerotic disease? Arteriosclerosis. What is arteriosclerosis? Anybody? Have you heard of what? Hardening of the arteries? Huh? All right. Sclerosis means to what? Scar. So if you got a lot of scarring, can that nerve impulse travel good? All right. So it's going to cause what? Problems with what? Again, muscle weakness, swallowing difficulty. Because why do you think it's difficulty in swallowing? What muscle deals with swallowing? What's the major muscle for respiration? You had that in Anatomy 201. The diaphragm. Yes. Okay. All right. So again, the neurotransmitter is not being reabsorbed. So you get glutamate that builds up, and glutamate is toxic to the nerve cells. That causes them to what? Scar. It's almost like fat in an artery. It causes it to harden up, right? If it hardens up, it's almost like a drain. If your drain gets clogged up, what happens to the water? All right, so if your blood vessels get clogged up, backs up. If your nerves get blocked up, so that means you can't keep going what? Forward. All right. Make sense? All right. So again, poliomyelitis deals with muscle weakness and muscular atrophy. Also what? Lou Gehrig's disease. All right. So look at table 13.2. All right. You got sensory, motor, and mixed. All right. If you hear the term somatic, that means what? Body cells. Okay? Like your pectoralis major, your pectoralis what? Minor. Your joints. Okay? Viscera means your heart, your lungs, all right? Your kidneys. General means what? General. And special means like what? Vision is specific, smell is specific, taste is specific, hearing is what? Specific. Make sense? All right. All right. Ganglion. This is a group of nerve cells that support your nerves. All right? And how many people remember the function of the posterior root ganglion? The posterior root ganglion. How many people remember? Yeah, from where? Yeah, into where? Central nervous system. All right. So this is their what? Swollen region, right? And these are little tiny cell bodies inside of there. And they carry that sensory information where? Into the central nervous system. All right. All right. Remember we said we had 31 pairs of what? And how many cranial nerves do we have? 12. All right. So again, we got 8 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 1 coccygeal. Okay? And remember, we said they exit out of what? Intervertebral foramen. So they branch out to what? Sides. Okay? Question. Okay. All right. the dorsal root ganglion, they carry sensory information into where? Spinal cord. All right, the dorsal root contains what? Soma. All right, that's the cell bodies that carry what? Sensory signals. All right. They say you got 6 to 8 rootlets. Those are the little branches. All right. If it goes to the motor, it comes out of what root? Anterior. All right. Cauda equina is your what? End. All right. L2 to what? Coccyx. Okay. These are spinal nerves. And we said you had 2 spinal enlargements. What were the 2 spinal enlargements? Cervical and lumbar. Okay? All right. All right, anterior and posterior. All right, anterior ramus. They're in the thoracic region. They branch in the intercostal nerves, and they form the anterior rami. A plexus means what? A group. So cervical plexus means all of the what? Cervical nerves, C1 through C8. Now thoracic is not a plexus, but you got the lumbar plexus. That's like L1 through what? L5. Sacral plexus, S1 through what? S5. All right. The posterior one, they get the muscles and the joints where? On the back of the what? Spine and the what? Skin. And we said the meninges, they innervate what? The fibrous connection over the brain and the what? Spinal nerves. Okay? So that's an example of a what? Spinal nerve. And the little rootlets, these are these little tiny branches that come off of a large nerve. So that's the big anterior ramus, but you get little small nerves that go to like your fingers and stuff like that. Okay? So you got a big one, but it gives little tiny branches to other what? Parts. It's almost like a flower or a tree with these multiple branches and leaves. They get smaller and smaller as they what? Branch out. That's what a cadaver looks like when you dissect the back of an individual whose nerves and things have been what? Died. Okay? And you see how thick the spinal cord is. Okay. All right. Now, when we look at the spinal nerves, all right, you got cervical plexus, remember brachial plexus, lumbar, sacral, and coccygeal. So C1 through C5 is our cervical plexus. And you're going to learn that these plexus do what? Overlap. When you get to brachial, that's going to be like under the clavicle going into the what? Armpit. All right? The phrenic nerve, that's C5. C5 goes to where? The diaphragm. If you compress C5, that will stop you from breathing. So that's why they outlawed the chokehold. I mean, think about what cops used to do, and it just happened in New York. When they put that billy club here, or if they get on your back and compress it, if I compress C5, it's going to stop your diaphragm from working. If your diaphragm don't work, can you breathe? No, you're going to suffocate and die. That's why they made that move illegal. All right? So, normally, the guy they were doing it to, I guess he kept saying he couldn't breathe. So if you can't breathe, you're going to keep what? Moving. All right? So that's like you damn if you do and you damn if you don't. All right? All right, brachial plexus, what do they get? The upper limb, shoulder, neck. How many people heard of carpal tunnel? All right. Carpal tunnel is when you type a lot and move your wrist, where it's the median nerve. You got what is called, you know what y'all did, the joints. A retinaculum is like a fibrous band, right? So what happens is the more you use that, you get inflammation. That puts pressure on the median nerve that runs into your hand. So when they do carpal tunnel release, they have to make an incision and cut that retinaculum band to open it up to take the pressure off of the median nerve. Okay? Lumbar. It gets the abdominal wall, anterior thigh, and your genitalia, and here it gets the lower part and the coccygeal from S4 to CO, coccygeal 1. All right, so let's look at proprioception. What did we say proprioception was? All right, so that's looking at our bones and joints, right? Remember, muscles are attached to bone by way of tendons. What do ligaments connect? Ligaments, what do they connect? Tendons connect most of the bone. Ligaments connect bone to bone. Alright? Okay? So they have a what? Motor function. Skeletal muscle contraction. Alright. How many people heard of chicken pox and shingles? Alright. Varicella zoster virus. The same virus that causes chicken pox also causes what? And the reason why is that when you get it, they don't leave your body. The virus stays somewhere within your what? Sensory nerve. They follow the path of the nerve. That's why shingles is so what? Painful. Alright? So what it is, the same organism. Alright? So what happens is it remains where? Near your posterior root ganglion. So when it flares up, that brings sensory things where? Into the central nervous system. So they follow the paths of the nerves. That's why you get it around your chest and places like that. Alright? So skin lesions, discoloration, fluid-filled vesicles along the path of the what? Nerve. Your chest, your waist. Alright? So the vaccine, it reduces your risk, but it doesn't eliminate your risk. Okay? Alright. Alright, so here's our cervical plexus. C1, C2, C3, C4, C5. So when people get a cervical fracture that severs the nerves, look how all these nerves interact. You got C1, right? That's hypoglossal. That's coming off of your cranial nerve number 12. But look how C1 connects with C2. Look how C2 connects with C3 and C4 and C5. And off of these you got what? Rootlets that go to different parts of the body, right or wrong. So if I sever C1 or C2, ain't I going to be paralyzed from the neck down? That's why. Because they're inner what? Connected. Alright? So you got your lesser occipital, your great auricular, transverse, anal cervicalis, got an anterior posterior root. Here's C5, your phrenic nerve. Each one of these go to a particular what? Part of your what? Body. Make sense? So when they do a neurological exam on you, and if some part is numb or something like that, they can tell what nerve is damaged. Alright? Alright, this is your brachial plexus. Alright, so once you go under the what? What bone is this? Clavicle. Alright, what bone is this? Humerus. Alright, so once you get under the clavicle, you begin it, and in the armpit, that's your brachial plexus. So when they do carpal tunnel, you lay it out on the table. Alright, they're going to start a IV to kind of relax you. But what they do is they draw up anesthesia. They inject it into your armpit. You see this whole big group of nerves here? Alright, they said, let me know if you feel any electrical stimulation in your fingers. When that little needle touching here, you should feel electrical stimulation here. Then they're going to aspirate. Then they're going to inject numbing medicine in. That numbs everything from here all the way down here. So they don't have to put you to sleep. Generally, they can give you some IV sedation, but they can do it local because you numb. Same thing with a what? Spinal tap. So you got your what? Axillary nerve, your radial. Here's the median nerve. All right, this is the one that causes what? Carpal tunnel. These are your digital nerves, okay? Make sense? All right. Okay. That's what nerves look like in a cadaver. Okay? So when you go to medical school and you start dissecting cadavers on gross anatomy, they tag these things and they tell you to name that nerve. Okay? All right, these are ones in the lumbar, L1, your iliohypogastric, all right, your ilioinguinal in the inguinal area, obturator nerve. How many people remember the obturator foramen from Anatomy 1? Obturator foramen is that hole right there. Okay? Uh-huh. And you remember your inguinal is in your groin area? All right. Okay. These are the sacral and the coccygeal. Okay. All right. When they talk about crutch paralysis or wrist drop, have you seen people on crutches? Have you noticed that they cushion that crutch? Because if you don't, if that crutch compresses those nerves in the brachial plexus, it can cause wrist drop, or what they call crutch paralysis. Because anytime you traumatize a spinal cord injury, before they can determine if you have true paralysis, they have to wait till the swelling goes down. How many people have gone to sleep on your extremities and you wake up and it's numb and tingling? Well, you compress the nerve. So when you get up, it's trying to what? Wake up. So once you get the swelling out the way, it feels better. So when you get spinal cord injury or trauma, you have to wait till that inflammation goes down to see if it is really what? Paralyzed. Okay? So that's what I mean. How many people had sciatic nerve pain? All right. Sometimes what happens is, you know, if you got like a wallet is too heavy with trash, like mine, there ain't no money in it. But if you sit on it, it pushes on that butt nerve and it makes you numb. All right. How many people heard of a herniated disc? All right. You know why it hurts so bad? Think about it. These are your vertebrae, right or wrong. All right. Herniation means that disc swells up, right? If that disc swell, it's going to shift that bone, right? And it's going to pinch on that nerve. If I compress that nerve that goes down, it's going to make me hurt. So your herniated disc can cause what? Nerve pain. That's why. Due to what? Inflammation of that what? Vertebrae. And the disc is that intervertebral what? Fat pain. Make sense? All right. All right. So you can get gluteal region all the way down to the what? Leg and ankle. All right. Now, how many people heard of the term dermatomes? All right. How many people had a neurological exam? Anybody? Neurological exam. All right. How do they do it? I mean, when you just go to your, you get a physical. All right. How do they do a exam on you? Just your internal medicine or whatever. Raise your hand, sharp dull. Do they make you follow all like that? All right. They touch you? All right. I have to understand. I can't cut you open to look at your nerves, can I? Yeah, I'm just doing an assessment on you. So how do I know just by touching you and making you do something, I know your nerves work? That's you, all right? If I touch you cross here and you can feel it and I know you breathing, I know C5 works, all right? If I touch you here, I know C8 works. If I get you here, I know L5 works. On your body, by checking these pressure points, that's what acupuncture come in at. This reflects all those nerves I just showed you. So a dermatals are a neurological map of dermis, skin, based on the different pressure, just like we talk about touch, pressure, pain, all like that. Then they tell you what's going on outside to what? Inside. So by going from the outside to inside, it has to travel on what? Nerve pathways, ascending what? Descending. So this lets me know that the inside works what? Properly. Make sense? Okay. All right, what's a reflex? Okay. When you hear the word stereotype, occurs essentially the same way every time. Would that be true or false? True. All right. And what do I mean by that? A reflex that's the same all the time. Give me an example. When you hit your knee? Okay. All right. What if you sit down in a tub of hot water? You're going to jump out, right? All right. What you said?
You ain't gonna get married though,
Okay. All right. If you eat something too hot, what are you going to do? All right. So if I do the same stimulus, you're going to have the same response, right? If I increase the stimulus, you're going to have an increase what? But if I hit my knee, I'm going to get the same sensation. If I put some hot in my mouth, I'm going to spit it out. If I step in some hot water, I'm going to get right back out. That means stereotypical. Same response if the stimulus is the same. All right? All right. Involuntary occurs without intent and are difficult to suppress. All right? That means I cannot increase or really decrease my heart. I can try yoga and things like that. All right? You know, like kids say, I'm going to hold my breath. Well, hold your breath till you pass out. As soon as you pass out, you're going to start what? Breathing on your own. Make sense? All right. All right, but you're right. A reflex is a quick response, all right, to a sensory input. All right? So reflexes include what? So when we look at the reflexes, all right, remember you got, what are the three types of muscles do you have from 201? Who remembers? Smooth, cardiac, and skeletal. You forgot skeletal? All right, when you hit, what did I tell you? If you hear the term somatic, what does somatic mean? Body cells. What does visceral mean? All right, so organs. So somatic is innervating what? Skeletal muscles. Okay? All right, so somatic receptors, skin, muscle, or tendons. What did we say afferent do? Afferent. Sensory. And it carries it where? Yeah, it goes ascending, but how does it get there? It goes from the periphery into, by way of, posterior ganglion. All right. What is the integrating center? What do we say? They call it integrated association area. What does that do? It processes. So it tells it what part of the brain to what? Go to. What does efferent fibers carry? Motor. And what is effector? Perfect. All right. You cooking. All right. So let's look at a patellar reflex. Okay? So if you're sitting and you're hanging your leg over the table and I tap on your patellar tendon, all right, that reflex sends a sensory input where? posterior root ganglion. Look at the picture. Follow it. Where is it going? What is the red one doing? If I hit it, sensory coming where? Okay, but it's coming in from that tendon by way of that muscle, dorsal root ganglion, posterior horn, goes up to the integrating system. It's going to come out the anterior horn because it's a skeletal muscle. It goes here to make that knee what? Kick out. So I'm stimulating my what? Extensor muscle to extend my leg. All right? Make sense? Okay. That's a simple what? Reflex. All right? What did we say proprioception was? All right? A muscle spindle or a stretch receptor. All right? Your muscle spindle, I don't know if y'all remember that gamma, that alpha 1, gamma 1 in that muscle spindle in the anatomy, but you got receptors in that tendon that's connected to that what? Muscle. So when I hit that tendon, it sends that response into that muscle to whatever muscle fiber I'm stimulating into here to make that what? Contract. Okay? Or extend. So that's why I get the muscle tone, posture, coordinated what? Movement. Okay. All right, there I go. You see that? You see your intrafusal muscle fiber and extrafusal, alpha and gamma. Those are the things that you stimulate in order to get the muscle to contract. What bone is that? Who can remember? What bone is that? That's the femur. All right. What bone? What part? What is that? On the femur. This the femur. That's the head of the femur. What is it attached to? What? Acetabulum. What is that? That's your greater trochanter, remember? Lesser cervical anatomical what? Neck. All right. So once you stimulate that tendon, that sends an impulse to those muscle fibers to make it what? Contract. Okay. So let's look at it. You got 7 to 8 intrafusal. All right. The rest of the muscle fibers that generate the force are the extrafusal. All right. Your gamma, they innervate the ends of the intrafusal muscles to keep them what? Taut. Don't they tell you to do what before you work out? So you keep the muscles in a semi what? Contracted state, so when you stimulate it, the response is what? Much faster. All right? So you got primary and what? Secondary fiber. So primary deals with the length and the speed. Secondary just deals with the what? Length of it. So that means your stride when you're stretching out that muscle. That's it. Okay? So again, reflexes help to maintain what? Balance, posture, equilibrium. Okay? Make sense? All right. All right. So patellar reflex is a knee jerk. They call it what? Monosynaptic. The reason why it's called monosynaptic, look at what happened. Mono means what? Okay. So you got one sensory in, one motor out. It's just a smooth what? Movement. All right? No other things are going to be what? Involved. All right? All right. How many people remember agonist and antagonistic? What is agonist? And antagonistic. What does antagonistic mean? Now, I know y'all know. Antagonistic. Well, agitate. What else? Come on now. All right. If I stimulate my extensors, what do I have to turn off? If I do this, I'm doing what? I'm what? If I do this, I'm doing what? So if my flexors are turned on, can I extend it? No. Because flexors are antagonistic to my what? Extensors. Agonist means it helps. Antagonistic means it goes what? Against it. So in order for me to extend it, I have to inhibit my what? Flexors. In order for me to flex it, I have to inhibit my what? Extensors. They both can't work at the same time. Make sense? So in order to excite one group, I have to turn off the what? Other group. Make sense? All right. All right. So look at this. All right. Walk through the steps for a patellar reflex. Now you got a bunch of things going on inside of there. All right. What's number one? So I excite what? A what group of muscles? Quadriceps what? Femoris. Y'all remember what they are, right? All right. What's number two? It travels where? By way of what type of fibers? Into what? To the posterior horn. What's number three? The alpha motor neurons in the muscle cell. What's efferent? It stimulates the quadriceps to what? Causes a knee jerk. At the same time, you get afferent nerve fibers stimulate what? Okay, where's number 5? All right, and then that what does? It inhibits the what? Alpha motor neurons to what? Hamstrings. So I don't want my hand. Where are your hamstrings? Right? Where are my quads? That extends it. I got to shut off the what? That way it won't interfere with it, right? 7 hamstrings contract is inhibited, so now you can what? The flexors are turned off because they're antagonistic to the quadriceps, so now I can what? Extend my knee. Now when I relax, I turn off the extensors, then I activate the what? Flexors to bring my knee what? That's it. That's a reflex. Okay? All right, look at number. All right, cross extensor reflex. All right. How many people have done this? If you how many people have been on the beach and stepped on something, or been walking in the house and stepped on something? All right, if you step on something with one foot, what you do? You pick it up. All right, what keeps you from falling? Okay, so they call it cross extensor, right? Why is it called cross extensor? I flexed the side that's hurt, and I did what to the opposite side? I extended it. That's why they call it the cross extensor reflex. I flexed one side, and I had to extend the other side to maintain my what? Make sense? Very simple. I stimulated the flexors on one side. I inhibit the extensors, because for me to do this, the flexors are turned on, my extensors are what? And on this one, my extensors are turned on, but my flexors are what? That's where you get the cross extensor, or what they call the flexor withdrawal. I flexed it, and I withdrew it off of the what? Object that was causing me what? Pain. Okay? Same thing here. But ipsilateral and intersegmental and contralateral. Remember, ipsilateral is the side where it hurted at, right? Contralateral is the opposite side that to help me maintain my what? And intersegmental, look at all these hot spots that's going on. I got things going on in a lot of different places, right? In order for this to hurt. But it came in on one side. You see how it crossed over to get one side to flex, the other side to what? Extend. Make sense? All right. All right, and this is just your golden tendon what? Reflex. All right? Make sense? All right.